Okay, keep it going now until it gets here. Over to you, Matthew.
So much. Thanks. I'll probably use this one.
Okay.
And I'll leave this here for our first panelists. Clicker's just behind. Good day, everybody. Thanks so much. Hi, good morning, everybody. Good morning. I'm Matthew Hulse. I'm our global focal point for digital health. It's so excited to see everybody, and on behalf of our team and many of our countries that we were able to support and join at the Global Digital Health Forum today, excited to lead this next session. I wanted to briefly talk about how the World Bank is supporting a collaborative approach towards strengthening primary health care. I think a few folks are interested in this topic. And then other pieces we'll have today is I have some colleagues that are excited to share some resources, as well as the chance to invite a lot of our client counterparts, representatives from country governments, and team members on stage to talk more about what's happening on the ground. Let me briefly just mention about the challenge that our institution is rising to deliver. We recognize that essential health services still have access, quality, and affordability issues all around the world. There's a lot of challenges. It's been a challenging year in global health, and there's always the emergence of risks coming with health emergency preparedness. We have shrinking financing in the health space. Disease challenges are adverse. And there's climate change and fragility that's affecting health systems and our ability to support the service delivery to individuals all around the world. This is also why, though, that specifically the bank is trying to really mobilize around supporting investments to increase affordability and access to health services. Our own institutional target is to try to reach an additional 1.5 billion people in the delivery of quality and affordable health services by 2030. This is around over 100 countries that we're a financial partner to, with over $25 billion in net commitments in supporting health financing and access to services around the world. We know that this is also not just about the financing, but it includes addressing the needs of the health workforce, the quality, the knowledge and policy work, the collaborative impact, and the enabling environment and ecosystem factors that enable health systems to deliver for people around the world. This is also a significant opportunity for both job creation and poverty alleviation by being able to deliver more health care and work collectively to make services available for people around the world. Beyond just the financing, the World Bank is both a knowledge and a technical assistance partner along some critical entry points that we know are important for scaling the access to health services. While many of us in the room today are engaged on topics around digital health, I know that it's part and parcel to components around effective health systems measurement and policy guidance, supporting human resources for health, access to essential medicines and commodities, the pharmaceuticals and supply chains work, private sector integration and partnerships. And a lot of these areas are where we are trying to bring both financing, knowledge, convening, and assistance to improve the quality of care, increase reach, support integration of service delivery across the life course. Now, on the specific pieces of digital, many of us have worked for so many years and align with this value proposition of what does digital health do in the macro picture of quality and affordable health service delivery. A lot of the way that we're framing our investments are about trying to improve access and expand coverage. It's also about resilience and sustainability. We bring financing for digital health because it can bring both equity and quality in care, the efficiency, transparency, and accountability argument, particularly with financial workflows, and more important than ever, around the equity angles, improving and enhancing the patient and provider experience in providing healthcare services. Just to give some strategic framing around where we're looking and seeing the requests coming from our Ministry of Health and our Ministry of Finance counterparts that are our financing focal points. It does look in the coming years around building a multidisciplinary health workforce. This is both a people-centered approach, again with that focus on health service delivery, but also substantially enabled by digital technologies and the strong partnerships and working with the market and other solution vendors that can provide and integrate those types of services available to build a comprehensive workforce to meet the service challenges. It's about integrated service delivery and the expansion of these services and scaling up to meet that need. I can't emphasize enough that while I'm mentioning primary healthcare here, this is really an entry point for integrated health service delivery across how much digital technologies are bringing about the opportunity to link those health systems together and deliver collectively for people seeking care. And digital transformation is a key reform area that many of our country clients are approaching the bank for help in both financing, policy guidance, knowledge reform, around how to use that as a vehicle to deliver on this health service challenging goal. I also am coming to talk about, and one of the reasons we're excited to be here is because of this stronger call around how we can work with both private sector investment across the entire value chain, not just in digital health interventions, but also in the access to services, the strategic purchasing of public care facilities, the access to essential medical products, and the entire value chain of delivering long-term care, preventative care, care at home, and beyond. And of course, digital technologies play a role at all of these points in the care journey, and things that we know are interested in and that the public health sector needs to mobilize both financing and solutions to solve. This is also one of the pieces that the World Bank is called to convene and break down some of these participatory barriers so that we can leverage the collective wisdom of groups like here, the partners that we can work with to deliver on this agenda. I want to conclude in some opening remarks before I move to the panel just on what it takes to deliver as a large institution like the World Bank. While myself and many of the colleagues here represent our health, nutrition, and population global practice, of course the World Bank is also delivering on digital transformation, electrification, agriculture, and financial services all across the world. We're seeing an increased call for both government spending on health, and happy to be a financing partner to support that. On our own part, we're trying to scale up some of our IDA and IBRD financing reforms to fund the health reforms to meet this service target. As part of the World Bank Group, the International Finance Corporation is also scaling some investments that's leveraging some of the private sector capacities for service delivery and innovation. And you've seen some of us in some of the other forums here around our co-financing and our partnership with other development finance institutions, multilateral investment banks, and beyond. And I'll just mention the multi-sectoral approach. The electricity group is connecting health facilities to electricity. Our digital transformation practice is building upon digital public infrastructure approaches for service delivery. Climate co-benefits. Our gender efforts to contribute to increase access to SRH services and improve equity and access to these services. We're really trying to deliver as one World Bank approach and bring the whole power of a multi-sectoral institution to support this challenge. So I'm grateful for the opportunity to share this framing and specifically what the World Bank is doing and why we're excited to lead with digital transformation as an area for support. But to hear more about what that support looks like on the ground, I'm going to introduce some panelists that we're excited to represent both from our team and some of the countries where we're both a financing and knowledge partner. We had one change in our panel, and I wanted to give an acknowledgement to Dr. Miriam Musama from the Ministry of Health in Zambia, who's currently transiting and we hope to be here later today. And so in her stead, I'm pleased to welcome our own colleague, Dr. Mamta Gimire, a health economist at the World Bank based in Kathmandu, to join the panel and talk about some of the work in South Asia. Please join the panel as I introduce everybody. And I'll ask you to collectively applause as I finish introducing our few panelists. We also have Mr. Gemechis Melkamu, the lead executive officer of the Ministry of Health in Ethiopia, to speak about some of the work here. Thanks for coming to join the panel today. Mr. Sean Blaschke, the Chief of Digital Health at UNICEF, one of our key collaborative partners on this agenda. And finally, I'd like to introduce our panel moderator, one from our family at the World Bank, Dr. Tony Mute, Senior Health Specialist and also the Global Lead for the Non-Communicable Disease and Mental Health Program. Let me turn it over to Dr. Tony, who will guide us through a panel discussion around what some of this work looks like on the ground. Thank you very much.
Great. Is my mic on? Can you hear me? Great. Thank you, Matt. And thank you to everyone for joining, both in person and online. I'll probably start with the framing. I think we've had the numbers. They are clear. And in many ways, it's a call to action. We've heard from Matt that half of the world's population does not have access to essential health services. Nearly 2 billion people are being pushed to extreme poverty due to healthcare costs. We've also heard that this is happening in the context of shrinking fiscal space, and as we all know, cuts in aid, particularly for health. And that means that, incremental progress is no longer something that is no longer tenable. And what we need to do is move towards accelerated transformation. We know that digital transformation is a strategic tool that can help us improve access, expand coverage for UHC, increase financial efficiency, and strengthen resilience and equity, but also enhance the experience of both patients and providers. So what we'll do for this panel, I will not reintroduce the panel. I think Matt did an excellent job of doing that. But on this panel, what we'll do is that we will bring that picture down to the front line of care with 3 goals. One is to highlight what countries and partners are doing to scale digital health interventions. We'll explore how the World Bank is supporting these journeys, working very closely with governments and partners. We'll also underscore that digital transformation must be judged by health outcomes. I always ask, digital health for what? So it really has to be underpinned by the fact that digital transformation has to actually address and support health outcomes. And without further ado, I will start by asking a few questions. We'll have 3 rounds of questions, and I will start with Gemekis. So Ethiopia has been working with multiple partners, including the World Bank, to move from a fragmented digital landscape to a more coordinated ecosystem. What challenges has the government faced in scaling your digital health programs? What kinds of innovative financing are you using to maintain momentum towards your digital transformation priorities?
Okay, thank you so much. I'm glad to be here to share the experience. So in Ethiopia, nationally, the government has strongly working to enhance the implementation of the digitization across the whole health sector, across the nationwide. So there is nationally, we have a digital council at a national level, and also recently the government has endorsed the Digital Ethiopia 2030 strategy document. So actually it was launched in 2020 for Digital Ethiopia 2025, but recently it was revised and endorsed last week. So the good thing is nationally the government is highly give a priority to digitize the health sector in this digital health, digital strategy document. So starting from that, as a ministry, we have a national digital health blueprint and other strategy documents to enhance the implementation of the digital system across the country. So we have implemented a number of digital platforms to support the implementation of the healthcare delivery. Especially we have implemented DHIS2 in all over the health sector, almost 100% in health and government facilities, and partially in the private sector. So we have around 38,000 users, and all programs are integrated in DHIS2. So primarily designed to collect the aggregated data, but recently we are also using DHIS2 tracker to track a specific program-related activity. So DHIS2 is one of the big systems which has the NCD, TB, malaria, all integrated systems are already included. The other big system we have is ECHIS. We have implemented ECHIS in more than 9,000 health posts at community level and in more than 2,000 health centers. So primarily it is designed to support the health extension workers. It is one of the job aid all the programs or service given at health post and the community level at PHCU level are integrated in ECHIs. It is a full module. It's like a mini AMR system. So that is one of the big systems. So the health extension workers are using ECHIs to enhance the service delivery in community level. The other system for the higher facilities like primary hospitals and high-level health facilities, we are implementing electronic medical record system, AMR. So due to the challenge with infrastructure and as you know, the implementation of digital health system is resource intensive. So we have now reached around 138 facilities are using the AMR, electronic medical record system. From those facilities, around 48 of them is now totally paper-free facility. So at MOH level, there are so many initiatives. We have a governance system. We have developed the national blueprint document to guide the implementation of the digital health system across the country. So the major challenge is the infrastructure for the remote facilities in the pastoralist areas. We have a challenge with connectivity, and also there is a challenge with interoperability to interoperable the system. Actually, we have implemented around 54 systems, and recently we have registered all. And the main challenge is the interoperability, because some of the systems are online, the others are offline. It is a bit challenging to interoperable all the systems. So the insufficient hardware and other devices like computer, tablets, these are another issues. And the capacity in terms of human resource is another limitation. So in terms of financing, we are using the innovative, the blending method of financing. So the government and the donor will contribute, and we invest on those devices, so on those technologies. So our investment option is just we are investing for the same digital health ecosystem. So these are some of the issues related to the implementation of digital health.
Thank you so much, Gemachis. I think you've really done a comprehensive and concrete job of really highlighting the obstacles, but also the opportunities that you have in terms of creative financing to keep digital transformation moving. So we'll move to South Asia and specifically to Nepal. We know that South Asia is facing an increasing burden of NCDs, and the World Bank is doing quite a bit there in terms of providing support to countries. My question for you is, when it comes to digital solutions and digital transformation, what are some of the operational lessons that we are sort of learning working with countries, particularly around making some of these digital solutions usable and sustainable? Over to you, Mamta.
Thank you, Dr. Tony. So rightly said, South Asia region has a double burden of disease, increasing NCD burden and unfinished infectious disease burden. And our systems are stressed and fragmented, and one of the solutions that we see is to bring about digital transformations. And we do have some interventions in the field. I can speak specifically about Nepal because we have few programs there talking about digital health transformation and supporting government to do the right intervention. First, let me briefly talk about those interventions. In 2017, Nepal brought up e-health strategy with the ambition to digitize health data system in the country by introducing EMR, as Ethiopia just did. But the digital transformation currently, when we see that, the transformation remains highly uneven. The EMR, the hospitals, of course, adopted EMR, but then they adopted to a different proprietary software, which means those hospitals were using different, the system were capturing different elements. They were not talking to each other. The interoperability was not there, and there was also not connection with the national platform. So that happened because of the absence of national standard. And in our program, we are incentivizing government to come up with the national standard for electronic medical record, which basically talks about the workflow, the same coding, and other the bare minimum that EMR must follow. So in doing this, we definitely faced some of the challenges, and one of the greatest challenges was in the country like Nepal, where the system is devolved, whenever the central government decides to do something and there's no buy-in from the local government, there is some sort of friction ongoing. So one of the lessons learned was, there has to be a central level ownership, also the buy-in from the provincial and local government, so that the interventions can be adopted smoothly. That's one. And like in Ethiopia again, limited foundation of infrastructure was the problem, and one of the lessons was, if you want country to go through the digital transformation, maybe investing in building up the solid foundation could be the way to go. And the third one, investing in people, training clinician, data operators, and other human resource for health seemed to be critical, and in absence of that, whatever transformation was envisioned was actually not implemented. So those three are some of the hard lessons learned in operationalizing our program.
Thank you, Mamta. I think, thank you for grounding us on some of those operational realities. And, there's a lot of commonalities around what is happening in Nepal, but also what is also happening in Ethiopia. So thank you for that. Sean, UNICEF works across RMNCH, PHC, and now increasingly on NCDs and mental health. And you've been a strong voice of moving from vertical tools to more integrated ecosystems. What are you learning about designing digital health investments that serve multiple programs? So NCDs, mental health, RMNCH, without creating parallel systems?
Thanks, Tony. And I'd like to take a step back. I think many people in this room have been in this space for 5, 10, 15 years and have kind of seen and possibly suffered from the impact of this disease that we call pilotitis, and challenges now with AI-titis now creeping up. And so I think one of the lessons that we have learned here is the importance for one government to be able to articulate not just a vision on what they want to achieve in the health sector and why, which health outcomes they really want to prioritize through digitally enabled systems, but to go a step further into those costed roadmaps and blueprints. And I mention this in the context of everybody in this room because I think everybody here has a role to play. When we come in with vertical interventions, vertical programs, and great solutions that we see in the hallway, many of these, as we start to layer upon layer in a country, can easily overwhelm national health systems. That frontline health worker who's dealing with 7 or 8 or 10 different apps, a Ministry of Health that's trying to figure out how to resource, how to technically support all these tools, it becomes overwhelming. And so, one of the things that, as UNICEF, that we've been prioritizing with partners like WHO, the World Bank, regional health informatics networks, is working with government to make sure that they have a clear plan, that architecture, and we use this as a way to help guide partners into where they fit into that national plan. And so I think one of the requests I have for everybody here is to be very aware of how the countries that you're working in, how strong those governance structures are, and whether those plans are in place and costed, and if not, find the partners in the country who should be leading on this. Reach out to the ministry and let them know, great, we're very excited about this new AI-powered NCD screening tool, but we're concerned about the overall sustainability without seeing it reflected in that national plan. And so, again, as UNICEF, one of the requests that I've been making to all of our country colleagues is that every single digitally enabled health intervention that we're supporting needs to be reflected somewhere in a government plan. It needs to be costed and budgeted, and that we need to be looking at the bigger picture. So not just how we are supporting one pillar of excellence, but how investment in mental health might also be used to support immunization or SRH. And so maybe to conclude here, and again, I think everybody has a role to play, from governments to financing institutions to development partners, to be good stewards of the programs, the money, the resources that we have, and make sure that we're doing so in a way that collectively strengthens government's capabilities to provide a full integrated, digitally enabled set of health services to the population. Because when we don't do that, we ultimately undermine our own priorities. So I hope we can continue that thread during the course of this discussion. And again, everybody here, I think, again, has a role to play in ensuring that we're a force for good to support governments to implement, to articulate and implement that enterprise vision and plan.
Thank you, Sean. So what I'm hearing from you is foundational investments and planning, which involves architecture, standards, and systems, can serve many programs when done right. So just to pull on that, and back to you, Gemechis, sorry. Let's go deeper on how these investments and foundational investments are changing PHC and in particular NCD services in Ethiopia. In your own opinion and based on your own experience, what has been the most important steps in embedding digital interventions for health service delivery at the PHC level?
Okay, thank you so much. PHCU level healthcare is it's a priority for the Ministry of Health. So following that, we are strongly working to digitize the PHCU. So as I've mentioned it earlier, we have implemented a number of digital platforms to enhance a service at PHCU level. And also the NCD, the mental health and other programs are also embedded in our digital platform, especially as I've already mentioned that we have ECHIS at health post level. So the ECHIS has the NCD module and the mental health module and like that. So this is one of the very important systems. So the other system we have is called a simple app. A simple app is it's a light mobile application. It's implemented at a health center level. So PHCU has two components, the health center and the health posts are under PHC program. So this simple app mobile application is used to screen NCD, record the data, and also present a report to different part of the health sector hierarchy. So the other thing that we have also managing this issue using DHIS2 platform. It is an aggregated system. And the other thing we are recently implementing aggressively is a health extension program, the embedded learning application, which is to support the health extension workers. So all these platforms are primarily designed to support all the programs, including the NCD and other mental health programs.
Thank you, Gemechis. And I probably want to maybe bring in, I mean, for most of the times we talk about pelletitis, right? Whereby we have these small scale innovations that don't really move to scale. Maybe we can talk a bit about that. What will it take to sort of move some of these interventions to scale? And maybe I can start with Nepal. Mamta, do you want to sort of maybe mention how do we actually move to scale? Then we'll go back to also to Gemechis as well.
From pilot to scale, there are a few things I think helps, especially in context of Nepal. The first one is a no-brainer. There has to be an ownership from the highest level leadership. In our case, it's the Ministry of Health and Population because it is the implementing agency for almost all health-related interventions, and also that's the ministry responsible to coordinate with other line ministries. So ownership is there. That's the first one. And a second is really there has to be financing for every interventions, right? And if the Ministry of Health and Population or related stakeholder can be taken into confidence by the Ministry of Finance or the budget holder that this sort of intervention will be financed in the long term using domestic budget, of course, whenever possible, gives the confidence among those implementers to take that intervention to scale. And third is really also we need to think from the demand side. There has to be trust and confidence in that certain intervention or pilot that if it goes big, it will benefit those beneficiaries. So there's a trust element. And there are other building blocks. For example, in investing in human resource for health, again, somebody has to run it, right? And it's better to train the respective HRH. That's also critical. And of course, investing in infrastructure. That also is super important when any intervention has to be rolled out in its scale.
Thank you, Mamta. Trust, sustainable financing, which has to be domestically led, is some of those lessons and some of the ways in which we move to scale. Gemechis, how are we moving to scale in Ethiopia? Have we moved to scale? What are some of those underpinning principles that have helped or are helping Ethiopia move to scale with regards to digital transformation?
Okay. To scale up the digital transformation, we have recently designed to have a unified digital health ecosystem just to minimize the fragmentation, the costs and everything. So we have designed a new way because previously we were investing a lot on different digital health platforms. In terms of implementation, there are a lot of investment. So the fragmentation is one of the more investment areas. So we need to minimize the investment and increase the output. So we are working to have a cluster-based system implementation, and also we are making the system centralized to minimize the costs on the implementation. So recently we are establishing 7 different hubs across the country. These hubs are primarily designed to used as a hub, a data hub, to have a centralized system. So under this hub, we have different facilities linked to this hub through robust connectivities. Then when we bring the system centrally, the investment will be minimized, especially the implementation cost will be minimized. So this is one of the plan. The other thing is we have to invest on the same agenda, on the same ecosystem. So based on that, we are working integrately with our donors and partners, and also with government. So these are the way we are working.
Perfect. And you've done a good job of bringing us to the next question. Sean, many countries rely on a mix of strong partnerships, including private and public actors, and in this case, and in the audience, software companies, telecommunication companies, startups. So public-private collaboration is central. Based on your experience, what do good partnership models look like in digital health? And what safeguards are needed to ensure that these collaborations protect equity, trust, and country ownership?
Thanks, Tony. I think one is a shift from CSR models to shared value partnerships. I think it's important to recognize that both sides need to recognize what they're getting out of this and be transparent about that and make sure that it works for both parties. I would also say that we need to be very intentional with these partnerships. We shouldn't be reactive. Just because one private sector partner comes with some exciting new opportunity, does it fit in with the national plan? Is it addressing an unmet priority? Because not all partnerships, as appealing as they look, will contribute to bringing together a unified digital ecosystem, as we heard from Ethiopia. I think second to this is really looking at what this means for the mid to long term for both parties. Many partnerships come in with a lot of promises, a lot of upfront opportunities, free services for the first 2 years. Well, what happens afterwards? Is government, are they aware of what the costs are that they are meant to take over, whether it be license fees or technical support? Are the private sector partners getting enough out of it for them to continue to invest? Or is this a short flash in the pan partnership that was a priority for one person in the company, but the company themselves don't have a very clear kind of return on investment? And so I think, again, it's very important for all parties to understand, not just in the short term, but in the long term, what inputs, what resources are going to be required to sustain them. And then I think with the safeguards, I just want to touch on one area that I've seen coming up, and I think will be a big concern over the next few years, particularly with AI, which is governments being the stewards of their citizens' data, and private sector partners respecting that. And I think there's going to be a big risk of private sector partners looking to suck in and ingest data. We know that successful AI applications require large amounts of heavily localized information from citizens that is their data at the end of the day, that they really need to consent to, and which needs to be safeguarded and carefully used, because this information could very easily be used to target them, whether it is from unscrupulous partners trying to sell products to people whose lives are put at risk because of various different stigmas or whatnot. And so I think in terms of safeguarding, I do think probably the most important emerging issue is going to be how we manage and deal with personal data.
Thank you, Sean. I think that's an important reminder that we definitely need clear rules of engagement, particularly on equity, data protection, and ownership, because I think when we have clear rules, then we're able to deliver sustainable benefits for all. So within the next maybe 2 minutes, I'll bring this into conclusion, but I also want to take us back to health outcomes. We've spoken about architectures, financing, standards, and partnerships, but I would want to close this panel to discuss about health outcomes. At the end of the day, digital transformation will be judged by whether, for example, more people with hypertension and diabetes are identified early and are kept in the system and are supported to have control. It will be judged whether more children, adolescents, and adults can access mental health support closer to home. And last but not least, it will also be judged on whether health workers at the primary care level feel adequately supported and not more burdened by digital tools. So I'll ask each of you to provide a brief headline reflection, just 30 seconds or so. And I'll start with Chis. In a sentence or two, when you look at Ethiopia's digital investments, where do you already see clear improvements in outcomes and quality of care?
Okay, thank you so much. Maybe as already mentioned it earlier, so all this investment is the ultimate goal is to enhance the implementation of the healthcare delivery, especially improving all the programs at the PHC level is a priority area. So on this area, to frankly speaking, the government and other donors are highly supporting, especially the World Bank. They are supporting the implementation of a digital health system in different programs, mainly the infrastructure. Recently, especially the unified digital health infrastructure is supported by the World Bank. That's why we are building those hubs at selected different facilities, and we are connecting those hubs through SD-WAN connectivity to enhance the data exchange between the facilities, to give active decision making at all levels of the healthcare providers. So there is a huge investment. Recently, around 30 million USD are investing on digital health by the World Bank. So the other donors also supporting, and the government also supporting this project. So in terms of infrastructure, procurement of the gadgets, AI, and the strengthen the health system, there are huge investments.
Thank you. 30 seconds, Mamta. We know that the bank champions an integrated approach to health systems transformation, and also this includes digital transformation. How are we seeing these improve people-centered, coordinated, and continuous care in Nepal?
Sure. I'm too much focused on EMR because that's our current support to Nepal government. Helping government to create a unified EMR will help create a shared patient record, which means the record will follow patient, right? And in this way, the provider does not have to rely on paper or a different source of information. And this is a critical enabler of continuum of care. And the impact is very much clear that, for example, a chronic patient get consistent follow-up, does not have to do repeated tests, and eventually there has to be some positive population outcome, right? Patient health gets the due attention, and if that goes on, there will be a definitely positive impact on population outcomes. So our efforts to help government to come up with integrated system definitely leads to a coordinated care in the long run.
Thank you, Mamta. Last question, Sean, 30 seconds. From UNICEF's global vantage point, what is the one simple litmus test you use to decide whether digital health investments is truly improving outcomes?
I mean, I think it goes back to your question on measurement. Are we measuring the right things? Not the number of digital platforms deployed, or even efficiencies gained with the health workforce, or how much information is being moving. But I would challenge us. Many of us are what we measure tends to be focused on our individual intervention. Are we seeing improvements in NCD care for cancer or hypertension? But that still creates a situation where we're focused on our vertical. And I would suggest and challenge colleagues to look at those cross-cutting PHC-anchored system strengthening indicators to make sure that we're not just measuring our contribution to addressing that disease vertical, but to strengthening the broader system, which will make that intervention more resilient. And I would suggest one further step. We've talked quite a bit about the need for more domestic financing. Ministries of finance, they look for different things than health outcomes. And I think we really have an opportunity to also measure our contribution to economic indicators. Are we addressing unemployment in countries, creating jobs through these interventions, supporting the local market? Because these are the types of arguments for ministries of finance that will resonate and will open up those wallets a little bit more to investing in digitally enabled health systems.
Thank you, Sean. Before I hand it over to my colleague, Amaranth, I just wanted to maybe underscore that at the World Bank, we're very much committed to working with governments and partners to use digital transformation as a means for stronger PHC and better NCDs and mental health outcomes, and not as an end in itself, but actually to really transform healthcare systems and support health outcomes. Without further ado, and thank you so much, panelists, this has been a rich discussion. Without further ado, I will hand it over to my great colleague, Amaranth, who is a Senior Digital Advisor at the World Bank, to take us through the last few minutes of this session. Thank you.
Thank you to our panelists, and pleasure to be here with you all today. We are running a little bit short on time, so I am actually going to speed us very, very quickly through this. So the World Bank has been working on thinking about how we can support person-centered care for NCDs and mental health through digital transformation. And as a part of this work, we've collaborated very closely with colleagues who are focused on primary health care, as well as NCDs and mental health, to think about what we can do in order to strengthen our approach, to support colleagues. As we've heard, many countries are now facing that double burden of disease and struggling with how you can approach a fragmented digital health ecosystem to support continuity of care and coordinated care. And given that these are life course illnesses, you have to also think about care in new ways. So home care, self-care, care beyond the clinic. I am going to just very quickly walk us through to the most important part of this presentation, which is here at the end. We are launching a primer on digital transformation to support NCDs and mental health care. And it's designed to support both health system planners as well as funders really think about the role that digital transformation can play. We've designed it to be incredibly useful. It's not meant to be read, hop around it, use the parts of it that are most useful for you. And it breaks down each step of the care continuum to look at common challenges there and ways that digital can help overcome those types of challenges when implemented with health information exchange in mind. And there are also 8 real-world examples that you can look at to see how countries are tackling these problems right now. So without further ado, I encourage you to check out the primer. A lot of work has gone into thinking about how to make it useful to you all, so I hope that you can use it and use it to drive towards those improved health outcomes that we were hearing about. Thank you all.
Thanks for joining our panel. very much today. We've got so many great resources to share. A big round of applause here. Later today, we're excited to showcase even more of our work with countries that my colleague Ali will be leading on some of our digital health architecture work. And my colleague Tony will be in partnership with the World Diabetes Foundation talking more about the non-communicable diseases and mental health work. A big shout out to Amaranth and her great work on the primer. And thanks to the forum for hosting us here today.
Can we give them another round of applause, ladies and gentlemen? Wait. Photo.